case of humerus middle third shaft fracture for close reduction with the interlocking nail, pin marking, landmarks, anterolateral process of acromion. This is clavicle. This is posterolateral process of acromion. This is the incision pointing downwards from anterolateral surface of the acromion. 3 centimeters of skin incision. After skin, subcutaneous tissue. You have to detect the ratio of the deltoid. This is the rotator cuff. This is the rotator cuff. This is in this deep section. We have to open the rotator cuff in between the rotator. It should go in the rotator interval. Mark the entry with the help of the Steinman pin. While keeping the entry, we should keep the limb in 30-degree section rotation view. That is the true AP view with head in a big profile. While keeping the entry, make sure the arm is slightly extended to pass the Steinman pin into the proximal part of the head. Try to avoid entering at the footprint of the rotator cuff. Should our entry is at the just medial to the footprint, is at point just medial to the footprint in true AP view. Now I am going to see the lateral view. For lateral view, we have to internally rotate the proximal humerus fragment. You can see we have entered the proximal humerus, the center of the dead center of the head in both AP and lateral view. My guide wire is directing towards the anterior side. Now I am going to direct it slightly posterior. Now you can see that it is in the center of the shaft. After removing the guide wire, Steinman pin, I am passing the guide wire. So we have negotiated the fracture side with the help of guide wire. We are passing the guide wire, negotiating the fracture side. Now we are going to reach to rein properly until the distal up to the olecranon fossa. Otherwise, when you keep the nail, the fracture side will distract. Always rein one size upper than the original nail diameter, and make sure not to injure the rotator cuff while reaming. Always use sheath to protect rotator cuff and other vital structures while reaming. Types of humerus nails. It is a slightly curved nail. As it is a curved nail, you have taken slightly lateral entry, just medial to the footprint. If it is a straight nail, you can go for medial entry in the axis of the shaft of humerus. As it is a curved nail, I have taken slightly lateral entry. If the fracture is at the proximal side, we can slightly take medial entry such that it won't, proximal fragment won't go into varus. There is slight combination at the fracture side, but as we didn't open the fracture, it will provide a biological fixation. Lock the nail distally with the freehand technique. I am using Vicryl such that screw won't get misplaced in the tissue. Sure. I'm locking the proximal part. We have kept the nail and locked distally and proximally. Now I am going to close the rotator cuff. I have buried the nail. You can see the nail comes in line with the articular surface, in line with the humeral head surface. Now I am going to close the rotator cuff. This is the cuff tissue. You may close it with Ethibond if available. Otherwise you can use Vicryl also for closing this rotator cuff. Tight closure, proper closure of the rotator cuff is essential for patient such that there is no impingement of the nail rotator cuff junction and persistent pain and weakness of the rotator cuff. After adequate closure of the rotator cuff, I am going to close the deltoid interval and then I am going to close sub-Q and skin.